There are many health risks associated with cigarette smoking. According to the Center for Disease Control, the list of diseases that we know are caused by smoking now includes cancers of the cervix, pancreas, kidneys, and stomach, aortic aneurysms, leukemia, cataracts, pneumonia, and gum disease. The best thing we can do for ourselves and the planet upon which we live is to work as hard on cigarette smoking cessation as we can. Cancer, now, that is something serious that each of us should think about. According to the CDC, cancer kills 1 out of every 4 people. Choosing to make the conscious decision to smoke is about the same as saying, I really don't care if I die from cancer. Most people have the feeling that it will never happen to them. My stepfather smoked his entire adult life. He started when he was a teenager. He didn't quit smoking till he began to have trouble breathing, went to a doctor, and found out he had emphysema. That was 20 years ago. He found out recently, though, that he has stage 4 lung cancer. I feel bad for him because lung cancer, as well as cigarette smoking, ran in his family. All of his sisters died during the last 20 years from lung cancer. We watched each one of them go from diagnosis to death within 3 months, each passing within 5 years of each other. The benefits of smoking cessation begin to show up almost immediately, though. Anspaugh, Hamrick, and Rosado explain in Wellness Concepts and Applications that immediately after putting the cigarette out, the air around you becomes clearer and no longer harmful to yourself or children in the room. After just 20 minutes, blood pressure is returned to normal. A person's pulse rate decreases, and it's then that those suffering from cold hands and feet will probably notice a return to normal levels also. After just 12 hours, the carbon dioxide levels in the blood start to decrease, and within 24 hours, the chance of having a heart attack greatly diminishes. At the 36-hour mark, as the carbon monoxide levels in your blood decrease, the oxygen in the blood increases. And within just 2 short days, nerve endings start to regrow. It's much easier to exercise, and the ex-smoker will begin to have an improved sense of smell and taste. Between 1 and 9 months after quitting, there are fewer coughing episodes, less colds and flu, less fatigue, and less shortness of breath. The most amazing thing to find is that after 1 year, your risk of heart disease falls by 50%. And after 10 years, life expectancy is almost the same for those that never smoked a cigarette in their entire lives. Imagine that you're one of the non-smokers and that you're at your place of employment. You come around the corner heading into work and run into a cloud of smoke as you're greeted by 2 co-workers that are talking before heading into the office building. Well, if the entire campus of your workplace were smoke-free, the scenario would not be played out and everyone would feel much healthier. According to the American Cancer Society, businesses are becoming increasingly sensitive to health and safety practices at the workplace that protect employees. Tobacco cessation continues to be one of the most cost-effective measures to reduce healthcare costs and increase productivity at the workplace. For this reason, more and more companies across the globe are working on prevention and cessation of tobacco use. To protect all individuals from exposure to secondhand smoke, companies will, ideally, implement policies that require a smoke-free environment on all company property, which does include vehicles, and provide smoking cessation support for their employees and covered dependents. Now, the changing the behavior of a smoker is not an easy task. It all depends on what stage someone is at and their desire to quit smoking. Many people know that they should stop smoking, but smoking is an addictive behavior. According to tobaccofreeyou.org, the first step is deciding to quit. The next step is setting a quit date and then following through with a quit plan. Dealing with withdrawal is a step that is probably the hardest. The stages of change behavior model is based on research that shows that behavior changes related to smoking occur over a continuum. One of the best behavior change theories out there are the 4 A's. Avoid, which is avoid certain people and places that can tempt you to smoke. Stay away for now. Later on, you'll be able to cope. Alter. Switch to soft drinks or water instead of coffee or alcohol. Take a different route to school or work. Take a walk when you used to take a smoke break. Boy. Alternatives. Use oral substitutions like sugarless gum, hard candy, or sunflower seeds. And activities. Exercise or hobbies that keep your hands busy, such as video games, needlework, woodworking, etc., can help distract from the urge to smoke. One way to motivate change at each stage of the stages of change model, in the trans-theoretical model of change, the stages are pre-contemplation, which is not intending to change soon; contemplation, which is change is being considered but not definitely planned; preparation, whereas behavior change is intended immediately; action, where behavior change has been achieved in the short term; and maintenance, long-term behavior change that has been achieved. Something else that's very important that they point to is the 5 experiential processes. They are consciousness raising, dramatic relief, environmental reevaluation, self-reevaluation, and social liberation. During these stages, the person is becoming aware of causes, consequences, and treatment for smoking, becoming emotionally moved by smoking or non-smoking state, thinking about how smoking affects others and the environment, evaluating self-image as a smoker or non-smoker, and becoming aware of smoke-free alternatives in society. The 5 behavioral processes are stimulus, control, counter-conditioning, reinforcement management, self-liberation, and helping relationships. During these stages, the person is committing to action, substituting healthy behaviors for smoking, avoiding cues to smoke, adding new cues to do alternatives, and rewards for controlling smoking urges, and obtaining support from others. Do the trans-theoretical model of change, decisional balances, and adaptation prediction stage movement, evidence from smoking cessation and adolescence addiction. There are many smoking cessations out there, but 2 that help more than any other are evidence-based smoking cessation aids and having a positive role model to look up to. Evidence-based smoking cessation aids include nicotine replacement therapy and medication. Among the nicotine replacements on the market are nicotine gums, nicotine replacement patches, which are applied to the skin, nasal sprays, lozenges, nicotine inhalers, e-cigarettes, and medications such as Zyban, which is a prescription that does not contain any nicotine and is designed to combat cravings. The person trying to quit is to take them for 2 weeks prior to quit date, and then for 7 to 12 weeks after they quit. The other medication doctors prescribe is Chantix. Chantix attaches to nicotine receptors in the brain, reducing the pleasurable effects of smoking and to help reduce symptoms of withdrawal. Now, having a role model or someone to look up to can be very beneficial when trying to quit smoking. When someone looks up to and admires someone else for what they have done in their lives, they are more apt to exemplify the same desired behavior. Cigarette smoking is no different. If your favorite actor smoked 2 packs of cigarettes a day, then you heard that they suddenly were able to stop by sheer willpower, it would make it more desirable a behavior to clone. According to Black, Marco, Stiller, Zangu, and Gellish, physicians feel that patient-related factors found to be associated with successful health behavior change include patients' beliefs, attitudes, self-efficacy, readiness to change, and environmental support. Role modeling is a key construct in Bandura's social cognitive theory of behavior change. Researchers have found that patients of physicians who demonstrated healthy behaviors were more motivated to change their own behaviors and to have more confidence in the counseling that they received.